Well, Mary Lou, I think you're going to want to keep the pitches underhanded and low for a while, but we should get your shoulder feeling quite a bit better. It's actually doing pretty good right now.
It has improved. It just needs a little more help.
So right now it's been a 2 on a 0 to 10 scale.
But it was about 6 or 7 when you started.
So it's a lot better from the laser therapy. The issues involved with shoulders are often very, very complex. We can do almost anything when we manipulate things with our fingers and our hands. And so a lot of times people, I think, don't always value sometimes how good and great their upper bodies are, and sometimes we try to do too much with the shoulders. Again, we could work on a radio and come up with semiconductor materials and all kinds of creative stuff. So maybe we could go a little bit more gently on the upper body. Laser therapy, particularly with certain wavelengths and certain types of diodes, is very, very good with treating shoulders and treating tendinopathies, tendon issues, which a lot of times are involved, which are close to the surface of the body. So the idea is to keep people so they can write and
keep those limbs working.
Yeah,
yes.
And do what they enjoy doing. Right. Well, so what we're looking at supposedly here, at least at first, might be pain, but it's a great deal more than that. It's a freedom to function and to do things that we want to do. With Mary Lou, it's not been always the shoulder, although that's certainly been affected, but it's also been walking with her left foot. Yes?
Yes.
And so...
Well, both feet, but especially with the left because of that neuroma as well.
So laser therapy, it does take sometimes a little bit of time, but it's worth spending that time. Applying it directly to the area at a proper dosage, at a proper intensity, it provides the cells with energy which they need so that they can actually heal. And generally, if pain is improved, it suggests also that healing is taking place. And when we see people on a regular schedule, we endeavor to set it up so that people won't ever go backward. What we don't do is sign people up for a lot of treatment because sometimes people simply don't need that much. We try to treat close together according to the World Association guidelines and then see. But sometimes I think we're a lot better than that. And sometimes we're done in 4, 5, 6 visits. In any case, as long as we are seeing things getting better, that would be some indication to recommend that the person continue treatment. But I don't want to see someone in my office any longer than I absolutely have to see them. I'd rather that they're out having a little bit of fun rather than spending their days in doctors' offices.
It's a good idea.
Okay, let's have you just do a little range of motion with the shoulder. Okay. We're using a distal point with a laser needle also. This is on in Chinese medicine, the small intestine channel, small intestine 3. And the small intestine channel goes and does a lot of things right here around the shoulder, which is why we picked it.
That feels much better.
So, it was a 4, 0 to 10 right now, Mary Lou. What would you score your shoulder?
Maybe a 1
okay.
or 2. It's gone, really.
Okay.
Yeah, that's much better.